everyone. So today we'll be starting with the topic liver abscess. All right. So to define your liver abscess, it is a pus-filled cavity. All right. So your liver abscess are pus-filled cavities which are located in the hepatic parenchyma. All right. Now coming to the etiology, we'll be dividing this into two headings. The first being the causative organisms and the source of their infection. All right. So for the causative organisms, there is a mnemonic. All right. That is your P, A, S, and E. So P is for Pseudomonas. A is for your Actinomyces. S is for your Staphylococcus. And E has two, that is your Escherichia coli and Entamoeba histolytica. Right, and these two are your most common causative organisms for your liver abscess. All right, so coming to the source of infection, it could be via your portal vein. Second, any penetrating injuries. All right, thirdly, any ascending infection of your biliary tract. All right, lastly, it could be via the arterial supply. All right, that is your blood supply. All right, so now let's come to the morphological features. We'll be starting with the gross features for your liver abscess. All right, so what do we see here? So first we see there are multiple abscesses. There are thick fibrous wall in this diagram. So to study the gross features, first let's look what happens to the liver. So in this condition, the liver is enlarged. All right, the liver is enlarged. Second, what we see in your abscesses. Firstly, these are over 1 centimeter in diameter. All right. Second, they have a thick fibrous wall. That is, they have a capsule which is thick fibrous. Okay. Thirdly, the contents of these abscesses. So they have two things. One is your necrotic material, and second is pus. All right. So that was that about the cross features. Coming to the microscopic features of liver abscesses, there's another mnemonic for this. You can remember it as NNIF. So here N stands for neutrophils. The neutrophils are one, they are degenerated and are plenty. All right. The second, necrosis of the parenchyma. All right. The I over here stands for inflammation, and F stands for fibroblasts, which are proliferated. All right. With that, we're done with your liver abscesses, and now let's study your amoebic liver abscess. All right. So to define your amoebic liver abscess, this liver abscess occurs due to the spread of Entamoeba histolytica from your intestinal lesion. All right. Now, so we know the etiology here is the causative organism is your Entamoeba histolytica. All right. Now, coming to the pathogenesis, what happens here is that the trophozoites from the colonic ulcers, yes, via the portal system enter the liver. all right? And in the liver, what happens to these tropozoites is that they undergo multiplication. Okay, so these tropozoites, they start multiplying in the liver, and here what happens is that the amoebas, they start blocking the interhepatic portal radicals. All right, there is blockage of the interhepatic portal radicals. All right, which leads to your inflammation and necrosis of the hepatic parenchyma. Alright, so this is like a story. So what happens was there was an intestinal lesion caused by your entamoeba histolytica. So then these tropozoites from the colon, alright, the colonic ulcers where they were located via the portal system, they enter the liver. Okay, so what happens in the liver is that they start undergoing multiplication. Now these amoebas, they end up blocking the interhepatic portal radicals, which leads to two things: inflammation and necrosis of the parenchyma. Alright, now coming to the morphological features. Let's study the gross features first. So coming to the abscess, yes, it is located in the right lobe. All right, more specifically the posterior superior portion. All right, so the abscess is located in the right lobe in the posterior superior portion. All right, this is your abscess. All right, now then what happens? One point we have to know, which is a very important point, that is your anchovy sauce pus. Okay, now remember that this looks a bit chocolatey, okay, reddish brown in color. So what is this anchovy sauce pus? It is a central necrotic material, all right, and is reddish to brownish in color, resembles like a chocolate. All right, so this here, the central necrotic material, is your anchovy sauce pus, okay, also known as your chocolate pus. So that is seen here, amoebic liver abscess. All right, and now coming to the microscopic features, we see, yes, we see a central abscess, all right, which is your degenerated liver cells, neutrophils, and RBCs. All right. Second, we see our amoebas, fibrotic change, and inflammation. All right. So with that, we're done with amoebic liver abscess. A few other points we have to know are your clinical features. The first clinical feature is the individual presents with fever. All right. Second, there is pain. All right. Now, this pain is in your right hypochondrium. All right. Thirdly, there is tenderness and hepatomegaly. All right. Now, this is important, the investigations. This can be asked as a 3-marker for your final exams. All right. So, the first investigation that can be done is your complete blood count. Complete blood count. All right. And is checked for leukocytosis. All right. Second, serological test. Okay. And this is checked for antibodies against entamoeba histolytica. All right. Thirdly, the stool of the individual can be examined for your amoeba cysts. All right. And lastly, CT scan or MRI. Yeah. With that, we are done with your amoebic liver abscess, and now we'll be jumping to your Hyatid cyst. All right. So the last topic under your amoebic liver disease that we'll be starting is your Hyatid cyst. All right. So to define your Hyatid cyst, this is a cystic disease of the liver, all right, which is caused by your Echinococcus granulosus, right? So this is the causative organism for your Hyatid cyst. Coming to its pathogenesis, what happens is that your vegetables, right, which are soiled with dog feces. So what we need to know here is your dog feces, all right? So the vegetables which have been soiled or covered with your dog feces contains certain eggs of this Echinococcus granulosus, all right? So what happens then is that these are consumed by us humans, all right? And this leads to hexacanth embryo hatching in the duodenum, all right? And these embryos hatch into the duodenum and end up moving into your intestinal wall, all right? So from the intestinal wall, they end up entering the radicals of the portal vein. Yes? So till here what happened? There were certain vegetables which were soiled with the dog feces containing these eggs. All right, these were consumed by a certain person, a certain individual. And what did this lead to? The embryo hatched in the duodenum and then moved into the intestinal wall, from where it entered into the radicals of your portal vein. All right. After this, what happens is that the larva develops, okay, into the hollow bladder. All right, and from here, plenty of blood corpuscles, all right, develop from the inner side of cyst. All right, so the larva develops into the hollow bladder of your Hyatid cyst, and then plenty of these blood corpuscles develop from the inner side of the cyst. All right, so that was the pathogenesis. Now let's come to the morphological features. In the gross features, what we'll be studying is that the cyst is composed of 3 layers. All right, now these 3 layers, from your outside to your inside. Okay, so from the outside, the first layer is your pericyst. All right, now this is an adventitia layer. All right, now this is a fibrous tissue which is blended with the liver parenchyma. All right, second is your ectocyst. All right, now this is a laminated membrane. All right, now this ectocyst looks like a white boiled egg. All right, second, it consists of, it is acellular. All right, second, laminated. All right, thirdly, a hyaline membrane. All right, now the innermost layer is your endocyst. All right, so this is your inner germinal layer. All right, second consists of, we studied in the pathogenesis, blood corpuscles. All right, the blood corpuscles develops from the inner side of the cyst. All right, thirdly, there is fluid inside the cyst. All right, and this fluid contains numerous soluses. All right, SOLIS, soleus. All right, now let's look at the cross image. All right, so now coming to the cross features, the cross diagram. Let's start with the outermost layer. All right, the outermost layer, your pericyst, we see it here. All right, the intermediate layer, the second layer, ectocyst, is over here. All right, and the third layer, that is the innermost layer, endocyst, is this. All right, now here we see what we're studying, your Hyatid cyst. All right, these what you see are those brood corpuscles that we saw in your inner layer, that is your endocyst. All right, we see your Hyatid fluid here. Okay, we see the scolus is here. All right, and your Hyatid sand. All right, so that was that. Now coming to the microscopic features, we see the innermost layer, endocyst. All right, this is your endocyst. All right, and this layer, all right, is the intermediate layer, the second layer, ectocyst. Okay, and this layer is the third layer, or the, you can say, the outermost layer, your pericyst. All right, and here we have your normal liver tissue. So now let's come to the clinical features. All right, so the first thing, the patient presents with swelling in your right upper abdomen. All right, and the second thing we see is that there is, when pressure is applied on the adjacent side, it leads to right hypochondriac pain. All right, when there is pressure applied on the adjacent side. Now coming to the investigations. Right, in the investigations we see, the first thing we do is your CBC, that is your complete blood count, and we look for eosinophilia. All right, the second thing we do is something called as your Cassoni's test. All right, thirdly, there is MRI and CT scan. Right, with that, we're done with the topic amoebic liver abscesses. Before finishing, just a 3 marker that can be asked in your exams is the parasites that affect your liver. All right, so a good mnemonic for this is your F.M.E.L., family, like camel. All right, so your F stands for fasciola hepatica. All right, E stands for your amoeba. M is for your malaria. E is for the topic we just studied now, Echinococcus granulosus, and L stands for your leishmaniasis. Alright, with that we are done with today's topic, and I hope you guys enjoyed the video. Thank you for watching.